Welcome back to the Lipoedema Podcast. We are your hosts, Shell
and Tiana, and today we are joined by a Lipoedema warrior from New South Wales, Maddie Rose. Maddie, thank you so much for joining us today.
Thank you for having me. It's a pleasure.
We love having warriors on. It's so brave of you to share your story, and we love that. So thank you. Before we get started, I just want to put that out there, that it's very vulnerable to share your story. And so thank you so much for joining us today.
Appreciate that.
And how did you first come to learn of lipedema, Maddie?
Yeah, so I got diagnosed in August 2021 by Dr. Helen Mackey. I went to that alert clinic in Sydney that's affiliated with Macquarie University Hospital. And like many other women in our lipedema community, I had suspected lymphedema. So a few years prior to that, I think in 2016, I was playing touch footy, and it was like a six-a-side mixed comp, just casual competition, and a larger gentleman collided with me, and I remember hearing a crack, and we both fell to the ground, and I remember thinking, oh, I hope that wasn't me, and then I looked down and my ankle was on sideways, which is not ideal, and so I had a surgery to fix all the bones back in place. And then I had another surgery after that to remove the hardware. And after those surgeries, my right lower leg was always a bit bigger than my left. So my thoughts were I had lymphedema caused by some trauma from the surgery potentially. So I went to Alert, and Alert is an excellent option for diagnosis for anyone who has the means, and, you know, Sydney's in a travel radius for them, because they're pretty thorough. Not to say that you have to get a really thorough diagnosis, because there's so many NLD therapists and GPs that can competently diagnose you, but this is a really good option. They do really comprehensive measurements of your limbs. They do ultrasound. They do like a nice line of questioning for your symptoms. And the ultrasound showed that I actually had no edema. I had a lot of post-disease adipose tissue. That had obviously progressed in response to the trauma from that injury. And Dr. Mackey's advice at the time was exercise and eat well, which I quite liked how lacking in prescription that was, because sometimes I'm a little bit wary when we get very black and white prescriptive advice, because, as you know, lipedema is a nice nuanced condition that interacts with our genetics and epigenetics and environmental factors so individually. So she just was really like, choose a form of exercise that you know you'll stick with in an ongoing sustainable way, and you know that you'll do frequently, and maintain your weight in whatever way or shape or form that looks like, primarily because we know that the challenging cycle that we get with weight gain and lipedema and their little interplay with one another. So it was really good advice. However, I didn't come across surgical options as a solution until over a year after that.
Love that approach.
Yeah, me too.
Because that's what we say all the time. Like, whatever works for you is going to work. Like, you don't have to prescribe to one sort of exercise or one sort of diet, that it has to be maintainable for you and sustainable. So I love that they said that. That is really refreshing.
And it's not as overwhelming as well. Like, they're not saying you must do this and you must do that, and then it feels like you're changing your whole life. You actually are given the power to work out what works for you. Can I ask, Maddie, what did work for you at the time in terms of, like, what exercise did you particularly enjoy?
Well, intuitively, I have sort of ended up in the space of just walking, Pilates, swimming. Yeah, primarily walking is a big one for me. And I have a long history of attempting a lot of different exercises and sports. And it really makes sense now why those ones really suit me personally. And I like strength training, but very sort of slow moving, heavyweight, calm strength training. Yeah.
So before this injury and like the lymphedema and everything progressing and finding out about lipedema, had you ever had any other health issues? Like, was there anything that had plagued you, like, in your earlier years?
I love this question because the answer is no, but only because You don't know what you don't know, and your brain rationalizes things so much for you. So, for example, I had no idea that other people didn't feel like they had weights strapped to their shins every time they walked through sand or tried to go for a run. Like, I didn't know that that's what life could be like. And I always attempted running and would give it another go and try again. And it would really just be such a slog the whole time for me. Speaking on exercises, every few years I would reattempt going to the gym to do those like functional F45 HIIT style classes. And I remember I would kind of have a very mild, what I imagine to be a bit of a chronic fatigue response, where I would do the gym class and then I would have a real sense of fatigue for the 2 days following, my body was just in a sort of an exhaustion. And it makes sense now that it must have just been too inflammatory of an exercise for me specifically. But yeah, I would be doing these things and I would be going 3 times a week and I would be going for 6 months. And that's all the ingredients to say that you should be actually progressing and getting more fit, and these classes should be more easy for you. And that was never the case. So certainly in hindsight, I can be much more compassionate and forgiving and, really feel for that past Maddie who just felt like I was just never a very fit person or didn't really understand why it was such a challenge to do exercises whereby other people would progress at a really normal rate and get fitter and fitter. I always intuitively geared myself to wearing active wear that was long leg fitted leggings. And, I always kind of thought maybe that was because I didn't like the aesthetics of my legs in shorts, but actually I really do think that I really sought out the comfort and the zipped upness and the support that compression can offer you. So that has always been part of what I've worn for doing exercise, and that makes a lot of sense now. The excessive bruising, I had no idea how I rationalized that now. I've also just thought that my legs interacted in a clumsy way with obstacles around me, or that my identity was a bit bruised. But I never really noticed that it was confined to my lower body. I never really thought about how light touches would result in bruises and if that was problematic. But yeah, in hindsight, all the puzzle pieces really fall into place. I think back to a moment where I had remedial massage on my thighs once, and it was excruciating. And yeah, it's kind of all these. It kind of all starts to make sense and to fall into place. I wasn't ever able to identify them and delineate them as health concerns, which is interesting. Yeah.
Yeah, I was the same. Like, I always just thought my legs were deformed, so I never ever got any advice on that or sought any help for that. But I always had chronic gut issues, which is also linked now. And so that's just one of those other puzzle pieces that have fallen into place for me too, that you see all these other things. You're like, oh, yeah, okay, well, that now makes sense and that now makes sense.
It's like a big jigsaw and it's coming together.
Yeah, absolutely.
And I love how you say how it feels like you've got weights on your ankle unless you're in water. So I go and do contrast therapy in the mornings, and I think I have to actually get some weight for my ankles, because every time I take a big deep breath in, I float to the top of the water. Do you float a little?
I'm actually the opposite. My legs, so if I try and float, my legs sink. The bottom half of me sinks. I can float up here, but yeah, I have trouble floating. So we need to do a poll.
We might need to do a poll.
Who with lipedema can float and who does not?
I remember going to a school camp when I was in year 5 or year 6, and everyone would get badges for all the different sports like archery or kayaking or running or all these cool sports. And the only badge I got was for being the best floater in the pool. They had a floating pool. It was buoyant, and I was so, yeah.
That's amazing. I love it. I would be proud too. Yeah, because floating is so relaxing. And sometimes, I would like to float in the water, but my legs just sort of Like I just sort of tip like the Titanic and then I can't float anymore.
I
Leave buoyancy, Maddie.
yeah, I love floating, but then my kids all raft on for me to see if I can keep them up as well.
Ruiners.
All right. Maddie, what do you see as some of the key challenges for women with lipedema based on your experiences with the condition?
It's a good question. So I know that challenges for us impacted with lipedema vary quite greatly. I think some areas that I sort of care more passionately about are the limitations of the Western healthcare system and its interactions with kind of fall in the crack conditions like lipedema or chronic illnesses or chronic autoimmune challenges experienced by majority of women, as we know. So I guess the limitations around that, I think you can kind of group that into two different key areas. So I think the culture of GPs in Australia has room for improvement. And I think that the Western healthcare modality in response to these fall in the crack conditions, just has to recognize its limitations. And we really have to navigate our way into other modalities of health that can address our issues. So in terms of the culture of GPs in Australia, I feel like, so full disclaimer, this is anecdotal. This is my opinion. These are my experiences as well as experiences of family and friends. This is not peer-reviewed journal article stats. But in my experience, I have found that the culture of GPs aren't inquisitive and they're not curious. And I think that's pretty important and conducive to best practice diagnostics. I think that good outcomes from an interaction with a GP in Australia is too dependent on personality. So the personality of the GP, the personality of the patient. And that's just too many variables for an outcome. Like that's not actually like an objective way to get a good outcome for a patient. And then the third thing is I feel like there could be a bit more process, a bit more standard line of questioning and tests that a GP can do. And I fully understand that the limitations of this aren't just the culture and the health professionals. Of course, it's like the funding framework and the fact that you've got between 9 and 13 minutes to have a conversation with a stranger to really get a snapshot of your health. I found that in my experience, I have about 40 seconds to talk about why I'm there. The rest of the time they talk at me and I'll leave there with a prescription to an antibiotic or a prescription to the oral contraceptive pill. And I just don't think that that's a good enough repertoire of experience. The other thing is with the personality-based premise, I find that that's a challenge. I'm very confident in the medical space. I am confident to be assertive for my health, but I have many friends who are timid. I have many friends who don't feel confident in that space. They don't feel like it's appropriate for them to, return a line of questioning to an authority figure. And for them, their outcomes, I would say, are less desired than the outcomes I get in my interactions, which I'm a little bit more forceful. So I think that's problematic.
And then it's a skill, isn't it? And we don't all have that personality.
Absolutely.
It's a huge skill. It's an absolute skill. And I've learned that over time and honed that in, but mostly from, kind of a passion for this to be the case for everyone else. But I can't, that's just not. Some people's dispositions are more timid or they undersell their symptoms, whereas I think in our system you actually need to oversell your symptoms, which is not the demeanor of many people. And it shouldn't be the way it has to be to get an outcome. So, and then the other thing is like
have to scream from the rooftops to be heard.
No, exactly. The other thing I would love to see a little bit more of from GPs is just a little bit more of a holistic line of questioning, like you're there for 9 to 13 minutes. Yeah, it's quick, but I feel like that's enough time for a few questions. You might ask, like they might want to ask you how your bowel movements are, how your period health is, how, your skin's going. Do you have any skin cancer, suspected spots? What kind of nutrients are you having lately? How's your libido? Like these are questions that can help give
How's your sleep?
Sleep, oh my gosh, 100%.
They're all the questions that naturopaths ask. When you first see a naturopath, like the line of questioning is so detailed. It's all about all of that stuff, like how's your eye color,
Yeah.
and do you have
Yeah.
dark spots under your eyes, and show me your tongue, and like all of these things.
Yeah, absolutely. And I think that's just the general limitation of the Western healthcare system at the moment. I think it's changing. I don't think it's geared towards chronic illness, and I don't think it's geared towards picking up the warning signs our body gives us along the way before we can often develop a chronic illness. So a lot of chronic illnesses take time, and our body tells us things. So if you think about persistent fatigue, painful periods, dry skin, brittle nails, thinning hair, anxiety, IBS, like there's all these things, and you go in and you kind of display your symptoms, but if it doesn't fit into a very neat diagnostic tick box, then that to a discernible condition, then that condition has a pharmaceutical treatment option or a surgical treatment option, then there's not really much that modality of health can do for you. I'm obsessed with Dr. Anthea Todd at the moment. She's an Australian female health practitioner, and she talks about these modalities of health that are available. So you've got medical, which is great if you have something pretty acute and, that really does need care. And then you've got your functional modality, then you've got your energetic, which sounds woo-woo, but it's really not. And in that functional modality, she talks about what she calls your 4 female fundamentals. So your nervous system, your blood sugars, your metabolism, and your nutrients, and the balancing of them to help address underlying causes that are causing these warning signs, because your body is on your side. Your body is not trying to do these symptoms to spite you or annoy you. It's genuinely trying to tell you something. Yes, it's annoying how it tells you, but it's having a very normal response to an abnormal environment. And if we can pick up these underlying causes along the way, then we can prevent these annoying ailments down the path. And I think that women with lipedema may be more susceptible because we have a higher inflammation load, we've got compromised detoxification pathways. So in light of those challenges, I thought of some things, like some good sort of things to finish it off, just so it's not bleak. But go watch this TED Talk by Dr. Talithia Williams. It's on owning your body's data. So you're the driver of your collector, the assessor of your body's information. So she's a statistician, so she loves doing it with things like her daily temperature, but I like doing it with things like my iron tests over time or my B12 over time. Own your data, it helps make your case. And also Dr. Anthea Todd's book, What's My Body Trying to Tell Me? And also don't take individual guilt about your health, because the whole sort of system around you makes it challenging for you to, it's not a willpower thing. It's not a laziness thing or anything. Often the challenges we have are caused by the food that we're sold, or the cookware that we're sold, or the water that we it's not on you to take on that guilt, and it doesn't help. It's not helpful to have that guilt.
Systemic.
So. Yeah, exactly. Yeah.
Very cool.
That's my rant.
So, you're talking about being diagnosed after an injury. If you were diagnosed, preteen perhaps, how do you think you would have lived differently?
Yeah, I think the biggest thing is I feel like I gave 22 years away of my really valuable mental resources and energy and complete hyperfixation to my weight and what I ate. So I had about 22 years of disordered eating across a 36-year lifespan. And honestly, it just was an absolute waste of my precious, precious mental resources. I went on my first diet when I was 11 years old. It's just been like a journey of restrictive binge patterns. I finally, the last few years, have been able to be in a really good place with my relationship with food and my body, but just really grieve all that time that was given to tying my value with my weight. And the wild thing is that over that, once I hit adulthood and over that time span, like I probably only fluctuated in weight, like not that much of an amount, but it was the proportion of that to my absolute mental toll. Like it's just such a cost. Like it's such a cost.
Yeah.
And beauty is nothing to do with your weight. And when somebody sees you and they think that you're beautiful, they're not talking about like your little lower tum-tum or your, like a rash on your neck, or they're not talking about like, your healthy sized ankles or all the things that I used to worry about. They're really referring to the way that you make them feel, the way that you talk about something that you care about, the way that you engage in a conversation with them, the way that you exist in this world and interact with everyone around you. Like that's what makes you beautiful. And I think there was like one lesson, 1 year in that time, that 22 years, where I had such a positive year and such a good life lesson learned. I was living in Hawaii for a year. I was 24. I was like very positive. I was, believing in the magic of the world and blah, blah, blah. And, for all intents and purposes, I probably wasn't my, best looking self. I had an obsession with blueberry beer at the time. This is pre-celiac gene being triggered. I loved eating bananas. I have like 6 bananas a day, which I think is too many bananas. And I was growing out a really awful, odd haircut that I'd got in Melbourne just before I left to go to Hawaii. So I was like dirty. I was working I was farming, and yeah, it really just wasn't what I would consider like now in my more like cynical side of things, like my best looking self. But I was so positive. I was so confident. I was sun-kissed and happy and strong and well-nourished. And yeah, I remember coming across a very handsome Hawaiian gentleman who was like model level, handsome. And I just got him, like, no worries. But any other like moment in my life, I just would have negatively discounted that as an option. I would have just been really introspective about how I was coming across or how I was looking. And I wish that I'd held on to that lesson for longer, because it was just there's so much truth in it that I just taught people my value and beauty through like how I emulated it, right? So I'm working to get that back, because it's magic, and it's true, real magic.
Yeah.
But
That's such a good message.
Yeah.
And I think I identify with that, because when I look at the people that I love in my life and they come into my room or they come into my space, I'm not looking at their physical self. I'm just looking at like the energy that they bring and just like loving it so much. Like don't look at their arms or their legs or their skin or like.
Beauty doesn't have a look.
Yeah.
It has a feeling. Beauty's a feeling. It's an energy.
Yeah. And we know that, looking at other people and loving other people, but for some reason for ourselves, it doesn't feel the same. And it's really a hurdle that we need to jump over somehow.
Huge hurdle. And it's such a thief. Like it's a thief of joy. It's a thief of us being able to be present or partake in different activities. That thought that value is external and linked with how we look or our weight. It's just such a thief, such a cost, and just not worth the cost. So I really think that it might be our default, but we should do whatever we can, however often it's needed, to remind ourselves that that's just not how value works. It's not.
Yeah, it's a great message. I don't think we covered it initially, but when you were diagnosed, and sort of how would you categorize your lipedema now? So what do you think, what kind of stage you fall under? Where is your lipedema on your body? Can you just extend on that a little bit? Because then I'm going to ask you about what conservative management strategies you currently do.
Yeah, for sure. So I was stage 1, type 3 when I was diagnosed in August 2021. And I became stage 2 it would have been just a year later, a year and a half later. So stage 2, type 3, I think. Yeah.
Mm-hmm.
And it's legs and my arms. And I've felt like a lot of progression in my arms in the last 6 months. And I know I can talk to you a bit more about surgeries I've had, and maybe that is a bit of a consideration or a bit of an exacerbator, but it's really hard to tell because for me, I think one of my key contributors to progression is cortisol, chronic cortisol levels from my beautiful anxiety disorder that I get to manage. So
Yeah, definitely plays a key part. And I wonder if we did do another poll, this is the episode of polls, it seems, but how many people who live with lipedema also have a contributing, I guess, coping or way of coping in their life. So either anxiety or depression or some other psychological burden that they bear. Because I think you might find, like, I'm not saying correlation or causation. I'm just saying maybe there might be a parallel there because of how we've had to struggle, I suppose. And this is not just, lipedema. I'm sure people with chronic health issues, they have to fight more for their wellness, and that would cause some sort of deep striving and, I guess maybe would impact on our mental health as well. So you also, did you say it was celiac that you deal with as well?
Yeah, so I have celiac disease, and that gene was triggered when I was about 25, 26. Got really sick from glandular fever, the Epstein-Barr virus, which I think is a bit more problematic to get later in life. So I got pretty sick from that, and they often say that when your body goes through a period of prolonged stress, you can trigger your celiac gene, which is a shame because I lived so many years like enjoying sourdough and all the good things, and I miss them greatly. But at the same time, I mean, we're often advised to reduce our gluten intake with lipedema anyway. So it kind of, either way, I would have been told that I can't fully enjoy gluten.
Indulge. Yeah, fair.
Yeah.
Okay.
Yeah.
Thank you for that. So I wanted to get back to your conservative management strategies at the moment. What do you do to sort of manage your lipedema?
Yeah, so I really enjoy my compression garments. So I'm lucky to have custom flat knit Maddie Australia custom garments. I wear the Maddie Men Cozy. That's my favourite.
We love them too.
So good. I was able to access them through Enable New South Wales, which takes time to get onto the books for that. So anyone in New South Wales, try and really get onto that as soon as possible. You get up to 2 garments every 6 months. And yeah, instead of $1,200, it was $400 for 2 garments. So it's just like a significant difference.
We don't have anything like that in Queensland, unfortunately, but yes.
It's
very
crazy.
good to have that in other states.
Yeah, it can't even, like, that difference is enormous. So hopefully that's going to change for you Queenslanders. I've got a lip press, which I love and really enjoy. I find it quite a nice bit of, it's kind of like meditative as well. So my time in my lympho press is usually, it's not like, you get to lay flat, which is always nice for an hour. I really enjoy that. And I try and do my deep breathing to help with detoxification linked in with the lympho press. I do MLD therapy, but I'm winding that back a bit. I was mostly doing that quite regularly for surgery prep and post-surgery. It's just a financial thing. Like, you can't always do everything. I will do MLD for a little bit longer because I've got some subsidies under my healthcare, but they're pretty limited. I think they cap at like $350. So I'll get a few out of that this year. But I love my MLD therapist. She's an absolute angel and she's really holistic, and it's like she's got all the latest gadgets and things with kind of all the electrical stuff to break up your fibrosis. And she's got like red light to help with the scar from surgery. So she's really good. Mainly movement is key. I have a desk job, which I think is just, so challenging for us. We already know that, our lymphatics are pretty compromised, let alone adding, 8 hours of sitting onto that. So my biggest thing is just moving as much as I can in the hours that I can every day. And so I walk the dog every morning, Pilates regularly, swimming in summer. I love swimming. I find that really helps with any swelling and fluid retention for some reason. And I just try and eat quite well. I try and eat whole foods. I love some processed foods every now and then, but I try to make that the real minority of what I'm putting in my body. So love whole food, unprocessed foods, try and avoid preservatives and seed oils and things like that where possible. But like I said, I think the key thing for me is stress management. So just making sure that, which is quite linked to me doing Pilates regularly, me eating good food, that's all part of my stress and anxiety management. Working just work hours, like having a pretty healthy dynamic with my employer around just, work-life balance. And obviously that can't be the case 24/7, but when possible, like that, that needs to be the majority. And then the other thing is seeing a psychologist, which is subsidized as well under the mental health care plan. So I'm seeing a new one this week, which should be good. But they're the key conservative management strategies I use.
Excellent. And it sounds very holistic as well. Like there's physical things and there's psychological things and then there's nutritional things. Like you're really just covering all bases. So well done for being an advocate for your own health. You mentioned that you did MLD to prepare for surgery. Can you just touch on how many surgeries you've had and whereabouts in your body that you've gotten surgery?
Yeah, definitely. So I've had 2 surgeries with Lipedema Surgical Solutions. So Dr. Chris Leckich, supported by Dr. Reese Bennett, did those surgeries, and I did he did my lower legs in August last year, so front and back, and then my upper thighs were done at the start of December, so it's week 7 today. Following that surgery, that was posterior and anterior as well. So that was lipedema extraction surgery, and feeling good that I'm out of that acute recovery zone as of today.
Yay, amazing.
Yeah. Feels good.
What are your 3 takeaways from having your surgery?
Yeah, so my first key takeaway would be, this is my experience, so I don't know if this is universal. Prepare for quite a low after on day 2 and day 3. I've had quite a few procedures done in my life and I feel quite confident in that space, and I thought I was pretty good with pain. And the day 2 and day 3 following my first lower leg surgery was just not good. Like it was very, very low. It was very dark. I didn't expect that sort of style of discomfort and pain. For some reason, I was avoiding pain medication because I was worried about its impacts on my bowel movements, which I did very differently for my second surgery. I took all the pain medication. Just prepare for the low, and it's okay. You'll get through those couple of, that week or 2 or those couple of days or whatever that sort of period is for you. You can get through it. You are resilient. You can handle the pain. It is temporary. It will end. Do whatever you can in those to prepare yourself for something nice in those few days, like get movies ready or, get enough puppy pee pads to change them over so you feel clean and looked after, and just be kind to yourself. It's just a low couple of days that I didn't expect, and I expected it and prepared for it for my second surgery, and the experience was much more tolerable. The other thing I'd say is just manage your mindset and expectation. The goal of this surgery is disease extraction. I had some unrealistic goals around having supermodel legs following the procedure, but that's not the goal. The goal is really about reducing your diseased adipose tissue, alleviating your symptoms, getting quality of life back, mobility, all those things. That's the goal. And if that's the outcome you get, then it's been an absolute success, which is the outcome I've got. And healing takes time. For me, I was really disheartened after the first surgery because in the 2 weeks following, my legs look different, which makes a lot of sense because you're having very acute swelling. So I'm not really sure where that that unrealistic delusional perception came from. But after, like, it takes longer than I thought. Like, it was about the 3-month mark between my first and second surgery, and I realized, oh, okay, like, this is closer to the outcome that I'll see at the end of this, and closer to the feeling of improved lightness that I'll see at the end of this. But I still have more time to go. It's just a long process, and it's not a little surgery. Like, I'd say it's pretty serious. So of course it's going to take your body time to really heal from that, but the outcomes are amazing. Like, my lower legs now are 5 or 6 months post surgery, and they're really, really light. And like, I honestly feel like they don't need compression in the same way that I sort of was that desire for compression is alleviating, although that's a slippery slope, because I know you should keep it up as much as you can. But they're my tips. I think in terms of, like, practical things, just have enough puppy pee pads or something to kind of keep, like, your environment nice and clean. If you can, like, if you've got, like, a nice meal service, you can set yourself up with meals for the following week if you can afford that, and you've got something available that can deliver to your house. I think just having, like, pre-made, whole food meals following is really helpful. Alleviates a bit of stress on your carer as well. So
Yeah, excellent tips. Very good.
So we're done.
We're done. We've done all our questions, Maddie. It's been a pleasure talking to you today. Thank you for sharing your story. As Shell said, like, this podcast is made on the backs of, people's vulnerabilities, and we always just feel so grateful that we have people willing to share. And I feel like for those who are newly diagnosed, hearing your story and how you've managed not only lipedema but other chronic health issues as well on top of lipedema, it gives them the strength to know that they're not alone. And, like, that's the most important message that we like to put out there.
Absolutely.
Well, I was going to say, I'm huge fans of what you both have done, because not only are you connecting us with all the specialists, and not just those specialists, but the specialists who are really understanding all the cutting edge research and the new information that's coming around lipedema. So you're connecting our community with that, but also you're ensuring there's solidarity amongst us. Like, there's nothing else like this in Australia. So I'm such a huge fan of what you're doing, and it's so altruistic and so incredible. So thank you.
Thank you, Maddie.
We do it for you guys.
Yeah.
For us, especially cathartic to be able to talk to people like you and to our specialists as well. So
Absolutely.
Thank you for your time, Maddie.
Thank you, Maddie.
Excellent.
Take care.
Bye.
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 The Lipedema Podcast 2025 is powered by Elegance Lymphatic Care. Lipedema and its symptoms vary from individual to individual. The opinions and advice voiced in this podcast are of a personal nature and used for educational purposes.
Please take away from this podcast what resonates with you, and please see your GP or preferred specialist for diagnosis and healthcare. We are Shelley and Tiana from the Lipoedema Podcast. Until our next episode, bye for now.